So I'm glad to go after you. This morning I was debating whether to ride my bike to the campus. I live around the corner, and in fact this weekend my husband and I drove by NIH, and I said, oh great, I have a conference there on Tuesday, it'll be easy breezy, I'll just take my bike. And then we started kind of assessing the road, Rockville Pike, and I looked a little closer and I thought, no, I'm not really interested in taking my life into my own hands. So he said, well, you could go old Georgetown Road. And then we both kind of looked at each other, we're like, no, that's not really an option either. So our two options for me, really going probably what is about 1.5 miles, are extremely treacherous. I wouldn't walk them, let alone take my bike. So we have a lot of work to do on this front. I am going to talk about the exciting topic before lunch of health policy, health in all policy. And I'm going to cover 3 things: health impact assessment, cost-benefit trading, and then health impact bonds. And probably at each time I'm going to ask you guys what you know about these issues. I want to just acknowledge some of the people that have been the thought leaders in the area of health in all policies and in this area of cost-benefit trading. I'm just a messenger. I'm not the person that developed some of these concepts, so these groups are. We've talked a lot already about moving away from this medical model where we're treating sick people and moving upstream to the root causes of disease, knowing that social, environmental, and behavior actually contributes to 60 to 70% of a person's health. And it's not just the choir that's talking about this anymore. Now housing and community development professionals are actually talking about the contributions they can make to public health. The energy efficiency sector is talking about the contributions they can make to public health. So there's a full recognition that we need to start thinking about social determinants of health, which is the term people are using. Health impact assessment. So you have 3 choices here. You know nothing about it, you know enough to be dangerous, or you could teach a course in it. So how many people know nothing about health impact assessment? Okay. You know enough to be dangerous? Okay. You probably could teach a course on it. Okay, great. So sorry for the review for those of you who are more expert. HIA, in short, is just a very systematic and scientific process for incorporating health into decisions. You could do an HIA of just about anything. I'll just give one quick example. Down the road from my house, right around the corner from here, there is a development going in, a townhome development. And the developer will be required to look at the traffic impacts on our street. So there's 150 new homes. That means probably 300 cars because these are 2-car garages. Our community is, of course, concerned about traffic, pedestrian injury, air quality. Those things will not be considered by the developer. He'll look at just the traffic counts, but not at air quality that comes from that traffic. He won't look at pedestrian injuries from that traffic. So generally speaking, health is not incorporated into these kinds of decisions. It's not required by regulation. It's done in many cases as a voluntary initiative. There have been 225 HIAs up to date. That's up almost 100 from just 3 years ago. So the curve of HIA practice has kind of been going like this and then straight up. And I give the Pew Health Impact Project a lot of credit for that. They've really been promoting these. So like you can see here, they could be done on education policy, they could be done on housing policy, transportation. I'm going to give you one quick example of a housing HIA that was done. How many people are familiar with West Oakland? So it's a very distressed community, lots of busy interstates. There's the port of Oakland is nearby. About 60% of the residents live in poverty. It's a predominantly community of color. Residents were very concerned about this infill project that was going to be put in. It was a senior housing being developed by a group called Ibaldi. Now, Ibaldi was revered, I guess, by the community as a group that actually cared about community development, cared about communities. So they thought it was in their interest to work directly with Ibaldi to try and influence the development. And very briefly, they had what's called a rapid HIA. They had about 4 community meetings where they identified what were the key concerns. The community was concerned about noise. They were concerned about air quality. They were concerned about crime. And then for the retail part of this development, they wanted to make sure that it would bring fresh foods and access to services that the residents cared about. And in fact, it was very successful in the sense that Ibaldi ended up really changing a lot of their design plans to address these community concerns that came up during the scoping. A couple interesting things that just show that it doesn't have to break the bank or stop a project when you do a health impact assessment. They originally had porches that faced the busy interstate, and they changed those porches in the design to bay windows. The noisy side of the street, they insulated the windows to help reduce the number of noise annoyance for the residents. They ended up also, am I loud? Sorry if I'm blowing anyone's ears. And then they also agreed to work on some of the safety and the crime issues in the community. Finally, and probably most importantly for air quality, they did end up installing mechanical ventilation and filtration, which was not in the original design, and it cost about $100,000. So that was a more costly intervention, but that's something that the residents felt very strongly about. Cost-benefit train. Okay, this is a snoozer, but it's kind of an interesting thing here. OMB and CBO are embarking on a new policy whereby they will credit a program that saves money in a mandatory spending account. So it's best to describe this as in an example. If you're familiar with some of the home visiting programs, they've received about $124 million, I guess, budget in 2010, and it's been going up exponentially. So that's a mandatory entitlement program. But it estimates it'll save about $650 million in Medicaid expenses by virtue of enrolling high-risk moms in this program and improving outcomes for kids. So OMB and CBO are saying, okay, we will credit the savings to this other mandatory program by virtue of the investment that you're making. This is huge because it's been a huge problem in terms of cross-sectoral cost-benefit trading. Investments that, say, a housing developer makes in housing actually result in healthcare savings on the healthcare side that they never see. So how do you even the playing field a little bit and give credit to those investments that people are making? And this is what CBO and OMB are embarking upon. The trick is that they have to be mandatory programs. So it's not for a discretionary program. It's only for a mandatory spending program, the investment, and then the cost savings also in a mandatory program. I've got the OMB guidance if you want to read it. Very quickly, health impact bonds. Have anybody been following this, either social impact bonds or health impact bonds? So Collective Health is the group that's been advocating for these, and it's a very interesting idea of bringing private investment in to finance investments in health. And then the payback will be basically the return on investment for making those investments in health. In Fresno, the California Endowment has funded the structure of a benefit whereby they will reduce asthma costs by investing in housing and community interventions. The savings that the healthcare world will see are then going to be paid back to the investors. So social impact bonds are actually practiced much more routinely. Health impact bonds are fairly new, but they are a way for us to begin investing in the social determinants of health. So this is just a quick wrap-up that decisions can be improved when incorporating health, and they don't necessarily need to stop a project or delay a project or be costly for a project. And then there's some new tools for actually aligning the investments and then the payback for health policy interventions. So thank you. That's me, and that's my little guy.